Namaskar. A few days ago, without any notice, without any discussion, and for no obvious reasons, members of the Aiims Nurses Union barged into the main OT complex of the All India Institute of Medical Sciences and disrupted the surgeries that were going on out there. Patients who were there for surgery had been fasting overnight. Many had been shifted onto the operation table for their surgeries, but their surgeries could not be done because the nurses union forced the nursing officers to come out of the OT complex and did not allow surgeries to go on. One patient who had cancers of the kidney and who had kidney failure received dialysis the night before and was prepared for surgery for the next day. He was shifted to the table for cancer surgery, but because of the disruption caused by the nurses union, the surgery could not be done and this patient was shifted back from the operation theatre, from the surgical table back to the ward without the surgery being done. Many children who had been fasting overnight, who were under the age of 5 years, could not be operated on that day because of this disruption caused by the nurses union. Think of the mental trauma that the parents of these children, the child, and all these patients who had been fasting overnight and who had got a date for surgery weeks before had gone through. This is the type of behavior that the nurses union and the leaders did on that day. In addition, they shouted at doctors on duty and did not allow them to do their routine day-to-day work in the operation theatre. This is something which is not right, and this is not what the All India Institute of Medical Sciences or the health profession is all about. Healthcare workers, especially nursing officers, whose very profession originates from the lady with the lamp, Florence Nightingale, who propagated empathy, patient care, and going the extra mile for the patient's alleviation of suffering. They behaved in an opposite manner. Instead of relieving the suffering of patients, they actually caused more harm and put the life of many patients at risk. This is not right and this is wrong. And I think this was something which is inhuman, which is against the nursing profession, and is something that we at Aiims don't stand for. That many members of the nursing profession do not approve of what happened that day. Many of them want to come back to work, but are not being allowed to come back to work, and were not allowed to come back to work on that day and even now. I appeal to all of you to join your duties, and we will support you. This is what the nursing profession is all about. Working for your patients, working for alleviating the suffering of the needy, and you join this profession for this activity. So please come back to work for the goodness of your patient, for your own conscience, and to keep the flag of your profession high. Thank you very much.